Hi, I'm Dr. Jonathan Craighead, and this is a short video with some helpful reminders about recovering from your knee replacement surgery. The first few days after surgery, it's not uncommon to get lightheaded or dizzy when you first stand up. We would ask that when you're sitting or standing that you do so slowly and have your walker with you. It's also helpful to have a family member or friend nearby. You may put all of your weight on the leg, but we want you to use the walker for balance. Physical therapy should be coming out to the house to work with you within 48 hours of your surgery. If you've not heard from the physical therapist, please contact our office immediately. You should have an ACE bandage over your operative leg. This will stay on until the therapist removes it approximately 4 days after your surgery. Initially, we want you to keep that ACE wrap clean and dry. If you do shower during those first 4 days, put a bag or something over it so it does not get wet. Underneath that ACE wrap is a waterproof dressing. When the ACE wrap is removed, you may then shower and get the dressing wet. After the ACE wrap is removed, we will ask that you wear the compression stockings during the day for about a month afterwards. This helps with swelling and helps prevent blood clots. You may remove them at night and you may wash them as needed. If you have any concerns or issues with the stockings, please let us know. It's also very important to ice the knee afterwards. Please use either a frozen bag of ice or frozen vegetables or one of the Polar Care or Ice Chest machines for 30 minutes 4 to 5 times a day. This will help with the swelling and pain in the knee. After surgery, a lot of people want to lay around with the knee bent and a pillow underneath the knee. While this may be comfortable, it puts your knee at risk for scarring into a flex position and makes it difficult for you to get full extension. We would ask that when you're sitting in the recliner or laying in bed, you place a pillow underneath the heel so that the knee is fully straight. This will also place your toes higher than the knee, which helps with swelling afterwards. The numbing medicine in your knee will start to wear off usually 12 to 48 hours after the surgery. When this happens, the knee may be a little bit more sore. We have called in some pain medicine for you. If you're not allergic, we would ask that even if you're not hurting, please take the Tylenol every 6 hours as prescribed. We also have called in some Tramadol for you unless you're allergic to it. You may take the Tramadol as needed every 4 hours for pain. If the Tramadol is not controlling your pain, 2 hours later you may take the oxycodone or other narcotic that we have called in for you. If for whatever reason this is not controlling your pain or you're having any issues with the pain medicine, please let us know. The pain medicine can sometimes be a little constipating, and we would ask that you drink plenty of fluids and take a stool softener. It's also helpful to take the pain medicine with some food. Occasionally, if you take it on an empty stomach, you may have some nausea. We've also called in a medicine called Zofran for you, which is an anti-nausea medicine that you may take as needed. It's not uncommon to have some bloody drainage after the surgery. If you have blood that escapes from underneath your dressing, please let us know immediately and reinforce it. You do not need to go to the emergency room. The other thing I would tell you is it's important to stay well hydrated and eat properly afterwards. If you're not doing so, you may want to take a multivitamin. You should have a follow-up appointment with our office in 2 weeks. If you've not been given an appointment, please let us know immediately. Once again, we want you to have a safe and comfortable experience. If you have any questions, please do not hesitate to contact us. Thank you.